You may have heard people say, never sleep on your right side, or back sleeping is dangerous, or one bad sleeping position can trigger a stroke. But the truth is a little more serious and a lot more useful than that. The real danger is not one dramatic pose that suddenly harms you overnight. The real danger is when your sleep position quietly makes your breathing worse, your snoring heavier, your acid reflux stronger, your oxygen lower, and your blood pressure harder to control during the exact hours your brain is supposed to be recovering. That is the part almost nobody explains clearly. Because if you went to bed last night feeling normal, no chest pain, no numbness, no dizziness, no warning, siren going off in your body, you would naturally assume the night was your safe zone. You would assume that while you were asleep, your body was resting, repairing, resetting. But for many adults, especially after 50 or 60, nighttime is not always recovery time. For some people, it is when the airway narrows, oxygen drops, blood pressure fluctuates, and the stress on the brain and heart quietly builds hour after hour. And that matters because strokes do not only come out of nowhere. Very often, the conditions that make a stroke more likely are building in silence long before the event itself. Poorly controlled nighttime blood pressure, untreated sleep apnea, repeated oxygen dips, interrupted deep sleep, heavy late meals, alcohol too close to bed, and a sleep position that makes all of that worse. Those are the real problems. Those are the hidden triggers people miss. So if you clicked on this video expecting one simple rule like, never sleep this way again, stay with me, because I want to give you something better than fear. I want to give you a smarter idea, not a recycled idea, not a dramatic myth, a practical one. The position you sleep in matters, yes, but it matters because of what it does to your breathing, your neck alignment, your reflux, your snoring, your blood pressure, and your circulation across 6 or 7 uninterrupted hours. And once you understand that, you can make changes tonight that are actually worth making. Before we go further, let me ask you something simple. When you fall asleep most nights, are you on your back, on your side, or on your stomach? Just answer it honestly in your own mind. Because as we go through this, you are going to recognize yourself somewhere in this story. Here is the first thing to understand. The most important question is not, what is the best sleep position for every human on Earth? The real question is, what happens to your body in your favorite sleep position? That is where people get misled. Position that feels comfortable can still be working against you. Position you have used for 30 years can still be creating a problem. Comfort and safety are not always the same thing, especially once aging, blood pressure, snoring, reflux, neck pain, diabetes, extra weight, or heart disease enter the picture. When you are younger, the body often compensates for your bad habits. You can sleep twisted flat, face down on a cheap pillow after a heavy meal, after a drink, and you may still wake up and function. But as you get older, your margin gets smaller. Your sleep becomes lighter. Your blood vessels become stiffer. Your blood pressure may not dip normally at night. Your airway may collapse more easily. Your recovery is no longer automatic. That is why the same sleeping habit that felt harmless at 32 can become a real problem at 62. So let's start with the most common misunderstanding of all. A lot of people believe sleeping flat on the back is automatically the most neutral and healthiest position. Sometimes it is comfortable. Sometimes it helps certain types of back pain. But if you snore, if you choke awake, if you wake with a dry mouth, if your partner says you stop breathing, or if you wake up exhausted even after a full night in bed, flat back sleeping may be the exact position that is worsening the problem. Why? Because when you sleep on your back, gravity can pull the tongue and soft tissues of the throat backward, narrows the airway. In some people, it partially blocks it. In others, especially with obstructive sleep apnea, it can lead to repeated breathing pauses all night long. And those pauses are not harmless. Every time oxygen drops, the brain has to jolt the body back toward breathing, your nervous system gets activated. Your heart rate can spike, your blood pressure can rise, sleep gets fragmented, deep restorative stages get cut short, and your brain spends the night fighting for stability instead of fully resting. This is why so many people say, I slept 8 hours, but I still feel terrible. It is not always insomnia. Sometimes it is poor quality breathing. Think about how dangerous that becomes when you combine it with age, hypertension, diabetes, atrial fibrillation, high cholesterol, or a previous mini-stroke. The issue is no longer just snoring. The issue is that your body is being stressed over and over during the night. That is why for many people, especially those with positional sleep apnea, the problem is not simply sleeping on your back looks bad. The problem is that back sleeping can worsen airway collapse. And this is where a smarter conversation begins. Because the goal is not to scare you away from one position for everyone. The goal is to ask, if back sleeping makes your breathing worse, are you willing to stop treating comfort as your only standard? Now let's talk about stomach sleeping, because this one is often overlooked. Some people swear by it. They say it helps them fall asleep faster. They say it reduces snoring. They say they have always slept that way. But stomach sleeping usually comes with one major trade-off. Your neck has to stay turned for a long time, and your chest can feel compressed against the mattress. That may not be a crisis in a healthy younger person, but it can become a setup for morning neck pain, tension headaches, jaw tightness, restless sleep, and shallow breathing. You may not notice it while asleep, but you feel the cost when you wake up stiff, foggy, or worn out. And this is where people make a mistake. They only think in terms of dramatic danger. They ask, will this instantly cause a stroke? That is the wrong question. The better question is, does this make my breathing and recovery worse night after night? Because health problems at night often work through repetition, not drama. Position that reduces sleep quality, worsens pain, or keeps your neck strained is not doing your cardiovascular system any favors. Then there is the side sleeping conversation, which is usually better, but not always in the way people think. Side sleeping often helps keep the airway more open compared with back sleeping. It can reduce snoring for some people. It can improve mild positional sleep apnea. And for people with reflux or heartburn, the left side is often more comfortable and more protective than the right. That is important because if acid rises into the throat at night, it can wake you, irritate the airway, worsen coughing, worsen sleep quality, and in some people even intensify that choking sensation in the middle of the night. So when people say the left side is best, they are not talking about a magical side with mystical powers. They are usually talking about two practical benefits. First, side sleeping can help keep the airway from collapsing backward the way it often does on the back. Second, left side sleeping may be kinder to reflux than right side sleeping. That is useful, that is real. But again, it is not a superstition, it is about mechanics. Now let me give you the idea that makes this video different from the recycled versions out there. Position itself is not the full story, the position is the amplifier. If you already have a narrow airway, back sleeping can amplify it. If you already have reflux, right side sleeping after a late meal can amplify it. If you already have neck pain, stomach sleeping can amplify it. If you already bend your head too far forward with multiple pillows, even side sleeping can become a problem. If you drink alcohol before bed, any position that worsens your snoring can become riskier. If your blood pressure is unstable, a night full of poor breathing and repeated awakenings can make that morning surge even harder on your body. That is the smarter lens. Sleep position is not acting alone, it is interacting with everything else. Let's talk about those everything else factors, because this is where many people miss the real danger. The first silent problem is untreated sleep apnea. More than half of stroke survivors are found to have sleep apnea, and many people have no idea they have it. They assume sleep apnea only affects people who are severely overweight or who snore like thunder. Not true. Yes, loud snoring is a clue, so is gasping, so is daytime fatigue, so is waking with a headache, so is brain fog. So is high blood pressure that seems stubborn. So is waking up to urinate multiple times. So is a partner telling you that you stop breathing or suddenly jerk awake. If any of that sounds familiar, then the most important question for you is not, should I sleep left or right? The most important question is, could I be having repeated breathing disruptions every single night? Because if you are, then your sleep position becomes a tool. Side sleeping may help, elevation may help, but you also may need a proper evaluation. This is especially true if you have had a TI, a stroke, atrial fibrillation, resistant blood pressure, or severe daytime fatigue. The second silent problem is alcohol close to bedtime. People think of alcohol as a sleep aid because it can make you drowsy. But drowsy is not the same as restorative. Alcohol can relax the muscles of the airway, making snoring and apnea worse. It can also fragment sleep later in the night, increase awakenings, and worsen dehydration. So if you are sleeping on your back after drinking, you may be setting yourself up for a night of heavier snoring, lower oxygen, poorer sleep quality, and more stress on the cardiovascular system. Again, the position is the amplifier. The third silent problem is a heavy late dinner. You eat at 9, lie down at 10, and wonder why your sleep feels rough. A late heavy meal can worsen reflux, raise body temperature, and make it harder for your system to settle into deep sleep. And if you already tend to sleep on your right side or flat on your back, the discomfort can become even more obvious. Some people wake with coughing, some wake with a bitter taste, some feel pressure in the chest and assume it is anxiety. Some wake with a pounding heart and do not connect it to the meal at all. The fourth silent problem is pillow misuse. This one matters more than people realize. Many people do not actually need a new mattress. They need a better neck position. If your pillow is too high, your head bends awkwardly. If it is too flat, your neck loses support. If you stack 3 pillows under your head instead of elevating your torso, you may create a fold in the neck rather than a gentle incline through the upper body. That means you can still snore, still breathe poorly, and still wake up sore even though you think you are elevated. So if you tell me you sleep on your side, I still need to know how your neck is positioned. If you tell me you sleep on your back, I still need to know whether you are flat or slightly elevated. If you tell me you use pillows for reflux, I still need to know whether you elevated your chest or just crammed your chin toward your chest. This is why some people keep making healthy changes and still feel bad. They are changing the label, not the mechanics. Now let's talk about the morning hours, because this part matters a lot. Many strokes happen in the early morning window, and one reason experts study this is because blood pressure naturally rises as the body prepares to wake. In some people, especially older adults with hypertension, that morning surge is stronger than it should be. If you have spent the entire night with poor breathing, repeated oxygen drops, fragmented sleep, and pressure swings from untreated apnea, you are not waking up refreshed. You are waking up after a night of physiological stress right into the part of the day when blood pressure is already climbing. That is why I want you to stop thinking about sleep position as a cosmetic habit. It is not just about comfort. It is about what kind of physiological runway you are giving yourself before the morning surge begins. Now let me walk you through the biggest sleep position mistakes people make, not because they are flashy, but because they are common. Mistake number 1 is insisting on back sleeping, even though all the clues say it is hurting your breathing. If you snore loudly, wake with a dry mouth, feel exhausted every morning, or have been told you gasp into your sleep, staying flat on your back is probably not loyalty to a habit. It is resistance to a needed change. Your body may be giving you the answer already. Mistake number 2 is using side sleeping badly. Yes, side sleeping is often helpful, but not if your shoulder is crushed, your neck is twisted, and your spine is sagging. Then you toss, turn, go numb, and end up back on your back anyway. Good side sleeping usually means a pillow that keeps the head level, not dropped and not cranked upward, plus support between the knees if your hips or lower back need it. Mistake number 3 is believing stomach sleeping is harmless because it stops you from snoring. Some people do snore less on the stomach, but that does not automatically make it ideal. If you are waking with neck pain, headaches, facial pressure, jaw tension, or tingling in the arms, your body may be telling you that the trade-off is not worth it. Mistake number 4 is trying to treat reflux or apnea with a mountain of pillows. Often creates bending, not elevation. A wedge, an adjustable bed, or a gentle incline through the upper body is usually smarter than forcing the head into a steep angle. Mistake number 5 is ignoring the combination effect. Late alcohol, late food, back sleeping, and snoring are a much bigger issue together than separately. If you fix only one piece and ignore the others, you may not get the result you want. Mistake number 6 is dismissing the warning signs because they happen at night. People take daytime symptoms seriously. If they feel chest pain on a walk, they pay attention. If they get short of breath going upstairs, they notice. But if they wake with a headache, choke awake at 2 in the morning, feel exhausted despite enough time in bed, or wake with a racing heart, they explain it away. Stress, age, bad dreams, too much coffee, but nighttime symptoms are still symptoms. If you wake up in the morning with a dull headache, heavy fatigue, trouble concentrating, or that strange feeling that your brain is not fully online, do not only ask whether you slept long enough. Ask whether you slept well enough physiologically. Now I want to give you the 2 sleep setups that tend to help the most people. The first is side sleeping, especially if you snore, have mild positional sleep apnea, or struggle with reflux. Curled into a tight ball, not twisted with your shoulder jammed under you. I mean true supported side sleeping. Head level with the spine, neck neutral. One supportive pillow under the head, optional pillow between the knees. Optional body pillow in front to keep you from rolling forward or backward. If reflux is part of your issue, the left side may be especially helpful. This is not glamorous advice, but it is good advice. The goal is to keep the airway happier, keep the spine calmer, and reduce the things that wake you repeatedly. The second is elevated back sleeping for people who truly cannot tolerate side sleeping. Maybe your shoulder hurts too much. Maybe hip pain makes side sleeping miserable. Maybe you have spent decades on your back and every time you try to change you fail. Fine, then do not sleep flat. Try to elevate the upper body gently instead, not your head only, your upper torso. This can help some people with reflux, some with snoring, and some with mild positional apnea. It is also often more realistic than forcing yourself into a side position you hate. The mistake here is trying to become perfect overnight. You do not need a perfect new identity by tonight. You need a better setup than the one that is quietly failing you. And let me say something important for people over 60. If you are already dealing with high blood pressure, heart disease, diabetes, atrial fibrillation, prior TIA, obesity, or heavy snoring, sleep should be part of your prevention plan, not an afterthought. We talk endlessly about diet, walking, sodium medication, cholesterol, stress management. Good. Those matter. But if your nights are full of apnea, reflux, oxygen drops, and repeated surges in stress hormones, then your prevention plan is incomplete. That is why I want you to stop asking only, which side should I sleep on, and start asking better questions. Do I snore? Do I wake up dry mouth? Do I feel unrested even after enough hours? Do I wake with headaches? Does my partner say I gasp? Do I wake with a racing heart? Does reflux hit me after I lie down? Do I sleep much worse after alcohol? Do I always feel better when I accidentally sleep on my side? Have I been fighting blood pressure that never seems fully controlled? Those questions will tell you more than internet myths will. Now let me paint a picture of the person this video is really for. It is for the man who says, I've always slept on my back. Fine, but he is on 2 blood pressure medications, snores like a chainsaw, and falls asleep in the recliner every afternoon. It is for the woman who says, I just wake up with headaches sometimes, but she also feels foggy every morning and has been told she tosses, coughs, and snorts through the night. It is for the couple who joke about the snoring but have never once considered that it could be a cardiovascular issue and not just a noise issue. It is for the person who thinks the problem is aging, when the problem may be that their nights have become physiologically stressful. And it is for the person who has been searching for a unique answer because the old script is too shallow. The old script says one position causes everything. The smarter script says your position either supports or sabotages the systems that protect you overnight. That is the difference. Now, if you want to make this practical, here is where I would start tonight. First, if you know back sleeping makes your snoring worse, stop pretending that is a harmless preference. Train yourself towards side sleeping or slight elevation. Second, if reflux hits you at night, stop eating so close to bedtime and test whether your left side feels better than your right. Third, if you use multiple pillows, check whether you are actually elevating your torso or just cramming your neck forward. Fourth, if you drink alcohol in the evening and sleep terribly, do not guess. Test it. Remove it for a week and notice whether your sleep, snoring, morning clarity improve. Fifth, if someone has told you that you gasp, choke, or stop breathing, do not wait for a crisis to take it seriously. Sixth, if you wake with headaches, heavy fatigue, dry mouth, or a pounding heart, treat that as information, not inconvenience. And seventh, if you have major stroke risk factors already, understand that improving your nights is not a small lifestyle tweak. It may be part of protecting your brain. I also want to say this clearly. Sleep position can help, but it is not a substitute for medical care. If you have symptoms of sleep apnea, you may need testing. If your blood pressure is uncontrolled, you may need treatment changes. If you have sudden numbness, facial droop, confusion, severe weakness, speech trouble, or vision changes, that is not a sleep tip problem. That is emergency care. Never let lifestyle content make you minimize urgent symptoms. But for everyday prevention, the quiet kind, the kind that compounds, sleep is powerful. The room matters. The timing of dinner matters. Alcohol matters. Your pillow matters. Your position matters. Your airway matters. And what happens between midnight and sunrise may shape how safely your brain enters the next day. So no, the fresh idea is not that one sleeping position secretly causes stroke all by itself. The fresher, better, more honest idea is this. If your sleep position worsens apnea, reflux, snoring, neck strain, or oxygen dips, then every night you are increasing the stress load on a body that may already be vulnerable. And if you improve those mechanics even modestly, you may reduce that strain in a meaningful way. That is a much stronger message because it gives people something real to work with. Tonight, do not chase perfection. Chase one upgrade. If you are a back sleeper who snores, try side sleeping. If side sleeping hurts, support it properly. If you cannot do that, elevate your upper body instead of staying flat. If reflux is your issue, experiment with the left side and earlier meals. Alcohol wrecks your night. Stop romanticizing it as relaxation. If you wake up feeling like you battled through sleep instead of rested through it, believe that feeling. Your body may be telling you the truth before any test does. And if you are over 60, listen even more closely. At that age, prevention is rarely one heroic decision. It is often a series of small nightly choices that either help your blood pressure settle help your airway stay open, help your brain get real recovery, and help your morning begin from a steadier place. That is why this matters. Not because sleep position is magic, because sleep position is leverage. It changes what gravity does to your airway. It changes what reflux does in your throat. It changes what your pillow does to your neck. It changes what snoring does to your oxygen. It changes how hard your body has to work while you are supposed to be resting. And once you see that, you cannot unsee it. So before you sleep tonight, ask yourself one question. Is my current setup truly helping me recover, or have I just gotten used to something that is quietly working against me? That question alone can change more than you think. If the answer points you toward side sleeping, give it a fair try. If the answer points you toward elevation, do it correctly. If the answer points you toward getting evaluated for sleep apnea, do not delay. If the answer points you toward changing your evening habits, start there. Because the goal is not to be scared of sleep. The goal is to make sleep safer. And for a lot of people, safer sleep starts with one simple realization: the real risk is not sleeping the wrong way in some dramatic internet sense. The real risk is sleeping in a way that repeatedly worsens the hidden problems you already have. That is the idea I wanted to give you today. Not fear, not a copied formula, a better framework. Sleep in a way that protects your breathing. Sleep in a way that reduces reflux. Sleep in a way that keeps your neck supported. Sleep in a way that helps your body reach deep, stable rest. And if your nights are full of clues that something is wrong, treat those clues as the warning signs they may be. Because the brain you wake up with tomorrow is being shaped by the sleep you choose tonight. Sometimes the most powerful prevention step is not dramatic at all. It is changing the position, the pillow, the timing, the incline, and the habits that have been quietly making your nights harder than they need to be. That is how you make this title true without making the message shallow. Cardiologists are not worried about superstition. They are worried about stress on the system. So stop sleeping in any way that crushes your airway, worsens your reflux, bends your neck badly, and leaves you waking up drained, foggy, headachy, or gasping.